we go. There we go.
Instagram went right away.
Mm-hmm.
What'd you guys do?
There's a green check mark. That's what.
That's it. We're live.
Just like that.
Just like that.
Hot dog.
What's up, everybody? So sometimes this is like a 10-minute process. To get live.
But we got people hopping on right
Yeah.
now.
So we're takes a minute to get the technology part going. It's like 3 minutes after 12:30, but thanks for being patient. So
That's not bad because our whole goal at our office is that a patient never waits longer than 5 minutes.
So we made
3
it.
minutes in, we're
no
still
patient
going.
waited more than 5 minutes today. That's true. We do have that goal. Nobody waits more than 5 minutes.
We're still doing great.
I wish my doctor's office had that.
Oh my gosh, I wish my doctor's had. Every time I go to the doctor,
office in Las Vegas.
Right?
Yeah, I have to block off 2 hours every time I have a doctor's appointment, just because you never know.
It's the lamest. I have a
It is the
doctor's
lamest.
appointment today. We'll see how long I have to wait.
You should start a timer
And
Yeah.
post it on your Instagram.
and then post it on your
Yeah,
Instagram.
post it on your
My
Instagram.
expectations are always just a little bit too high for that. I know it's a me problem. So I want to talk about my black eye
Okay.
because you really couldn't see it on the last video that we were doing a little while ago.
Yeah, you got, hey, Mia Huff's on there. What's up?
But Mia, can you see my black eye from your side?
I say I can see it on the. Yeah.
Yeah. but
You
black
should
eye.
see the other guy.
He's in rough shape. Oh,
Did Tiffany give the black eye?
No,
Tiffany?
I did not give him the black.
I
eye.
tried to talk Tiffany into doing one of my ideas on a treatment plan. And she's like, no. And I said, yes. And she punched me in the eye.
No, that's not what happened.
So every couple months, my eye will twitch a little bit and I have to go get a little injection in my eyelid. And the lady gave me the injection and the next morning it was nice and purple underneath of it. So
But you had to wait. You had to wait to do the injection until after your son's wedding
that's
because
right.
you can't have family pictures with father of the groom with a black
Is
eye.
that his way of admitting he just wanted some Botox? Is that
Yes,
what's
it was
happening
Botox.
here? Just kidding.
We should Botox your
Filler?
forehead.
Thank you.
That
That
would
was
be-
not
that'd
very
be-
nice.
That'd be no. I think we should both go, but then patients would never know that like we have expressions. Like my eyebrows give away
I like my
everything.
forehead.
So yeah.
So this whole live is to talk about the teeth.
Yeah.
There are so many questions that patients are always asking. I see it on the Facebooks.
Should we introduce ourselves?
Oh yeah, if you don't know who we are, I'm Dr. Emmett. I'm a 3-on-6 provider in Las Vegas, Nevada. And this is
I'm Tiffany. I'm Dr. Emmett's assistant and implant coordinator and best friend and
I couldn't
got
wait to
talked
see how
into-
you were going to finish this sentence.
got
I'm
talked
so
into
excited.
doing these when he doesn't have a guest. So I co-host. We decided I co-host.
Yeah, that's
now.
an
Yeah.
official thing.
I
She's the official
co-host
co-host.
when we don't have a guest star.
And we have some exciting guests coming up. We're
Yeah.
going to have an anesthesia provider.
Mhm.
I'm actually bringing another 3-on-6 doctor
Yes.
on to talk to him about his
I'm
office.
excited about that.
So anyway, our goal every week is to bring up a topic in relationship to 3-on-6 and just talk about it.
Yeah.
And also let all the patients ask their questions. So if you're just joining, you're logging in, we encourage you to ask your questions because we'll talk about them live. And hopefully the questions are related to the topic of the day, but if they're not, we'll talk about it anyway. We get suggestions for future topics. So every other week we're live just for you guys. We're here just for the patients to talk about what's going on. So this week we're talking about the teeth for a 3-on-6. And what you can't see is we brought a bunch of models.
We got show and tell.
We have a
going on down
whole
here.
series of stuff we're going to talk about today. But I
Got
see
the
it
book.
in the forums and the chats all the time, and
Yeah.
people asking, how do we pick teeth? What do the teeth look like? What are the teeth made out of? How are the teeth held in? What kind of glue do they use? What kind of screws do they use? How do you pick the right teeth for your face? And what are the different options?
There was a patient that said, "What kind of glue do you use?" I'm like, "That's a bad word.
Yeah.
We don't use glue.
Spoiler alert, no glue was used
No glue, no cement.
for teeth. I use tissue glue.
Yeah, tissue glue.
We use a lot of tissue
Every once
glue.
in a while. Yeah, yeah.
So I think we're just going to start at the beginning, and I just want to talk about the shape of teeth.
Yeah.
And so let's just kind of start there. So I kind of have a unique perspective on teeth because I was a dental technician for a long time before I went to dental school. So my experience with teeth design and teeth shape and teeth selection and understanding the anatomy of teeth
Mhm.
is, I feel like that's a big advantage for me. And I think a lot of patients have mentioned that also.
So
That,
and for our patients will come in and they're like, I don't know what I want my teeth to look like. I'm like, don't worry.
Yeah.
I know a guy. I
We're
know
gonna-
a guy that'll help you pick out what will match your face.
We're going to
So,
figure it out. So maybe we can just kind of act like we're going through a smile design session,
Okay.
maybe a little bit,
Yeah.
and just talk about that. One thing that's helpful is when patients bring in a picture.
Mhm. Mhm.
So if we're talking about getting teeth that you want, and you can show us a picture of yourself or somebody else.
Yeah. I will say, I think it's more helpful when they have a picture of like younger them, because sometimes patients will come in and they'll have a picture of the big one right now is Halle Berry.
I know we
They're
got a
like,
lot of that.
Oh, I love her smile. I'm like, but your face isn't her face.
Yeah.
So it's like, can we make your teeth look like that? Yeah, Dr. Emmett can make your teeth look like anything, but is it going to give you the Halle Berry smile? Not necessarily, because you don't have her face.
Yeah, that's
So
important.
if I put Halle Berry's smile in I have a super square head. She has a really long, skinny face, and it's just they're not going to match the same.
Yeah.
So when someone comes in with a younger picture of themselves, like, I love when my teeth look like this. Cool.
Yeah, that is
Great.
helpful.
Yeah, very, very helpful.
And one of the things I tell patients, I won't let you make a mistake. I'm not going to let my very feminine patient who wants a really feminine smile pick the wrong size of teeth, maybe some big, huge teeth. And I'm not going to let my big blue collar concrete working guy pick some little feminine teeth.
Like
right?
dainty looking teeth.
So we're not going to let you make a mistake. But we get patients a lot that come in and say, I want a Hollywood smile, or I want perfect teeth. So I'm going to show you right now what a textbook Hollywood smile is. So would you open up this book? So let's talk about this book right now. This book has been around
That book.
For a very, very long time.
1997. We looked it up.
Well, yeah, this one was, I think,
published
updated
in
or something
97.
in 97.
Yeah.
But basically, these are some teeth design characteristics that we can use when we're choosing shapes and styles of teeth. So we go to the very back page real quick before we spoiler alert.
All of them.
So basically, if a patient walks into a room, nobody besides me and obviously all the 3-on-6 trained doctors are looking at their teeth and saying, oh, you have the natural, or oh, you have Hollywood, or you
that's
have
a nice functional smile.
Yeah, functional smile or oval. Right. That's the dental professionals that are doing that. But there are some key characteristics. So if we look at this book, I'll kind of get it as close as we can.
These have to get the glare on there too bad.
These are like the no, I don't want to say basic, the standard choices.
It's kind of your roadmap.
Good idea.
You can make
well said.
Yeah, because you can make changes to these. So,
but honestly, if you saw somebody walk in the room and they had any of these teeth, to the untrained eye, there's not a lot of difference.
Yeah.
So I'm going to just show you some hallmark differences. So if somebody comes in and they say to us, I want the Hollywood smile, that is the Hollywood smile. So what should you notice about the Hollywood smile?
Well, you'll also notice these are showing you upper teeth. Lower teeth are not in this book. Lower teeth kind of all follow the same.
Do lower teeth matter? Yeah, but just not as much.
Just not as much. You don't see them as often when you're talking. When you're
I just scooted this way closer to us.
Yeah,
because I happened to reach too far. Sorry.
Now you can see my pores. You're
really close. Okay.
Real close.
So Hollywood smile, there's almost a flat line all the way across the incisal edge. So flat canine, flat lateral, flat central, and they're all the same height. That's what it looks like in porcelain, and that's what it would look like in somebody's mouth, kind of a flat line across. Now, what's fun that I can do at my office that maybe nobody else can do at their office. Watch this.
Cheating.
Hey, Tiffany, show us a Hollywood smile.
Right there.
Look at her teeth. They're flat all the way across. She's got a whistle.
Mine are my natural teeth that have just kind of ended up in a Hollywood type smile. Mostly because I chipped a tooth and I was like, just make it flat.
Yeah.
Don't fix it. Stop fixing it. Just make it flat. So I've ended up in a Hollywood smile.
But it looks very nice. You have a beautiful smile.
Thank you. I get complimented on it all the time. So I'll
Yeah.
take it.
So in the office all the time, I'm like, so Tiffany, just show them a Hollywood smile, what it looks like. Okay. So in comparison, that's a Hollywood. Now the next one I go to is the natural smile. And I'll show you why. But this is a little bit different. This is more of they call this the natural. Get the glare off of it.
Mm-hmm.
So key differences. Look, my canine is pointy now instead of being flat. My 2 front teeth are still flat, but now look at this tooth. This is called a lateral. It's tucked up a little bit higher, or it's a little bit shorter here. So this creates some variation in the teeth. That's what it looks like in porcelain, and that's what it would look like in somebody's mouth. It's not quite as dramatic as you see here in the illustration, but you can definitely see it down here in their mouth.
Something else fun that we can do at our office.
So the other thing I can do, look at my teeth.
Show them your smile.
Close enough.
Yeah, it's good. You
Like
can
that.
see that your 2 front teeth are longer. So yeah.
My 2 front teeth are a little bit longer. My laterals are a little bit shorter, and my canines are pointy. So let's look at another style of teeth. Let's just go right to.
Well, I think it's important. There's different characteristics in these smiles that may feel more feminine or more masculine.
That's a good point. Let's
lots
talk
of-
about that.
Lots of patients will come in, they're like, oh, I want them really square. And then you give them that, especially female patients, and they go, they're really boxy. And as soon as you round the edge on the teeth, they go, no, that's what I wanted. And more rounded teeth, a little more feminine, more square, look more masculine, and
That's true.
more
So
pronounced canines are more masculine.
yeah, to make a more feminine smile, how do we do that? We round off the features of the teeth.
Mhm.
We make them a little bit smaller. We put a lot of patients. So first off, what percentage of our patients are in a Hollywood or a natural?
A lot of our patients are. Yeah,
Tons.
those are probably the top 2, followed closely by what you're about to
Yeah.
show.
So I'm
Yeah,
just going to show you another smile design here.
that's Hollywood.
Oh,
Back to the other page.
got to turn it
There we
around.
go.
Sorry. All right, softened.
Mhm.
So there's a softened look. Again, it's pretty much flat across. But how is this different than the Hollywood? We have a round canine, and the teeth have more of a bulbous type shape to them. So this is called a softened. And in someone's mouth, we can see what that looks like. Again, if they walk in the room, I might notice, Tiffany might notice, dental trained professionals might notice,
Yeah.
but nobody's looking at your teeth and be like, oh my gosh, that's the softened or the Hollywood.
I think a lot of our female patients end up in softened or oval. They might start by saying, I really want Hollywood. And then you give them Hollywood and they're like,
we do
I
get
want,
some of that.
maybe less square.
Maybe
You're
less
like,
square, yeah.
Yep.
So when a patient wakes up from surgery, our goal
Mhm.
is to have their teeth as close to ideal as possible. But out of all fairness, most patients' initial healing temporaries that they wear for the first 3 to 4 months are almost identical.
Mhm.
Everybody's are very, very similar. There's some reasons for that. So why is that? Do you want to cover it? Or do you want me to?
I'll have you cover it. I know there's there's a lot of different reasons like on the lab side. Part of
Mhm.
it is that you're asleep and we don't want to spend a lot of time changing little characteristics before like while you're asleep. Like these are very temporary. You're only going to
Yeah.
be in them for 3 months. It's better to get you awake and going home and starting the healing process than it is to have Dr. Emmett spend a lot of time being like, oh, change that canine. Oh,
Right.
let's make. So a lot of patients end up in very similar looking teeth, but that's not the last step. That's only the very,
you
very
covered
first
it.
step.
So it's all about what's called the same day conversion.
Mhm.
We're taking the scans of your implants that are in your mouth and making a bridge that fits over those implants.
I'm supposed to take your pen.
Take my pen away? I'm going to point to things.
Okay, you can point to
Okay.
things.
So that to try to make all these tiny little adjustments is not practical, but that's one of the reasons why we do a second set of temporaries, because that's the cosmetic stage.
Well, if there's certain things about teeth that like we have a patient who's like, do not put me in pointy canines.
Yeah.
So while our assistant was finishing them to, curing them and finishing them to actually put them in the patient's mouth while they were asleep, she made the canines flat.
Yeah, we can purposefully
There's
do
little
some things. If like,
yeah.
I do not want that.
Do
Great.
not give me
I don't
that.
want to give you
Yeah.
that. Then let's fix it.
Yeah.
Mia just asked, what is ideal? And that's such a good question. Ideal is different for every patient. I don't know if I can answer what is an ideal. Now, what's funny is we actually use that terminology in our office. We have something called an ideal temporary.
Mhm.
And that's just the most average set of teeth.
Yeah.
Like just
They're
very
just basic. Yeah.
almost anybody could wear these teeth and be totally fine. And we call that in the office, we refer to those as an ideal,
Mhm.
but every patient's ideal is different. We have patients who are very particular, and I have patients who we put in an ideal set of teeth an average set and they go, oh my gosh,
That's
it's the best
everything.
thing I've ever, it's
That's
all
exactly
I've
what
ever
I
wanted.
want.
And they're done, right? And I bet half our patients, when we talk about doing a second set, cosmetic set,
Mhm.
over half our patients don't want any changes.
Yeah.
They just say, make my teeth like the ones I've
Yeah,
been wearing for the last 3 months.
Well, I love when you go, is there any changes that you want to make? And they go, do I need to?
Yeah.
No.
Is there something wrong with my teeth?
No, you don't need to make a single change.
It's just an option.
They look great.
So what can we change? We can change the height of teeth, the width of teeth, the shape of teeth, and how each individual tooth relates to the adjacent tooth, the tooth next to it.
Mm-hmm.
There are limitations because this entire time as we're talking about like making changes to teeth, every time we make a change to a top tooth, we got to make a change to the bottom tooth.
Right.
And every time we make a change to a tooth on the side over here, we got to make a change to the tooth on the other side.
Right.
So it's very complex. It's not as simple as, oh, just make my front 2 teeth different. And patients will say that like, oh, just make my front 2 a little bit longer. I mean, you'd think that would be an easy thing to do, but it's very complex. There's a lot that goes into it.
A lot of your day is sitting there with the lab on a screen share going, okay, but don't make that one exactly like this one.
Yeah, I spend hours every day designing people's teeth.
And if teeth look exactly the same, you look like a robot.
Yeah, that's the other thing. So we got
to pick on him, but someone look up Rex Ryan right now.
Just don't call people out by name.
Coach Ryan. Sorry.
We have to consider
they look great. He just
making the teeth look natural too, because if they're just plain white and they're all flat and all square, that's probably not the ideal look you're going for.
David Hunter wants to know how your kidney stones are doing.
Look, we're gonna interrupt today's episode for Mr. David Hunter. This is a true story. I'm chugging water right now because whenever this is over, I'm driving very responsibly over to my CT scan to get my kidneys scanned.
His left one's great. His right
because my kidney is not doing awesome.
Slightly.
So yeah, thanks for asking, David Hunter. So,
but he started drinking way more water.
Yeah. So I'm currently doing well, but I'm working on getting that figured out. All right, we digressed. Okay, so teeth. We've talked about teeth shape, the autonomy that a patient has going into the teeth design. Mm-hmm. I want to now talk about. I want to show this model. I think this is important.
Yeah.
This is a model. We can actually see it pretty good on the black background, Daisy.
Tip it so that they can see it. Yeah.
So you can see the front of it?
Yeah.
This is a pretty standard looking set of teeth for a patient in a 3-on-6. Mm-hmm. And what you'll notice is it's just the teeth. It's the height of the teeth. It's the width of the teeth. It's the size of the teeth. And when we look at this angle, we can see the holes. What are those holes for, Tiffany?
Those are the screw channels. Those would go down to your abutment, which goes down to the implant.
And so there's a screw that goes down through that little hole.
Tiny little screw.
And if this is somebody's finals, can you see these screw holes?
And until you put the filling in. Yeah. I was at the very, very beginning, right after we put the teeth in, you can see them, but then you put the filling in and you're never going to see them again.
Yeah, we literally put the same material we put in a tooth. Mm-hmm. We do a filling in that little screw channel. So in your finals, you don't see that at all. Mm-hmm. But why do we see 6 holes?
Because there's 6 implants for 3 bridges.
There's 6 implants. There's 3 bridges.
I think we're going to talk about that too. The split between 2.
You know what? Let's talk about it right now. But let me show one more thing. Okay, so that is a 3-on-6 final
on the model.
Yeah, very pretty. It's zirconia.
When I tell patients when we're doing their consultation, that's a very popular look, but there's a billion variations to it. There's color and all the different things that you want to change, you can change.
What is this?
That is an all-on-X final.
Ironically, you guys, this is a pretty good all-on-X.
Yeah, it's not excessive.
I show this at my office all the time because I think it's not bad.
Yeah.
If you're a patient getting an all-on-X and this is your end result, you got a pretty good one. We've seen some really terrible ones, and this one's pretty good. Yeah. But what is the big difference? You can't feel this at home right now. I wish you could.
It's heavy.
Super heavy.
Yeah.
But look at how much fake gum material there is. Mm-hmm. And look at the way that it interacts with your gums.
It's hard to see, but it's flat.
Sits
like it's flat against flat.
On top of that gum tissue.
Yeah.
So that's the food trap that people talk about.
I think it's important. the pink gums that you're seeing, that means that's how much bone they removed in order to make room for that pink gum line.
Right. But that's a pretty good 3 on
Yeah.
or all on X.
Yeah, that's not a terrible.
But when
We've seen
you compare that
much
to
worse.
3 on 6, can I hold those steady enough?
Yeah.
The question is pretty simple. Like, which would you want in your mouth?
Mhm.
You'd want the natural teeth.
I like to have patients hold those in their hand
So dramatic.
because even with the plastic gums on this model that are showing you your gums, the weight difference between those two is insane.
Yeah, this is
Yeah.
pretty heavy.
Yeah.
Not boat anchor heavy, but pretty heavy. Okay, let's talk about the number of bridges.
Yeah.
Okay, and I think it's important. This is actually a 3 on 6 from one of our patients.
Yeah, she
But
we loved it so much that we ordered another set.
what
We're
I'm
like, send us another one of those.
going to do is blow your mind right now, guys. This is a patient with a 3 on 6. Look how many bridges there are. There's only 2.
Mhm.
There's only 2 bridges. So there's a lot of people that want to know how many bridges go in a 3 on 6. I tell everybody the same thing. Don't get hung up. And I tell them this in the beginning, by the way.
Yeah.
It's all about communication, but don't get hung up on the number of bridges, even the number of implants, but do get hung up on minimal bone removal and keeping your gums.
Right.
And having teeth that look like they're growing out of your gums. That's what you should get hung up on.
Right.
These are the things that matter. The number of bridges in an ideal, and obviously how we prefer it goes, is a 3 on 6. 3 separate bridges on 6 implants. But everybody's body is different. Everybody's available bone is different. The quality of bone, the angle of the bone, the way their jaw interacts with their top teeth, their bite mechanics. It's so complex that to say, oh, every patient's always going to get 3 bridges on 6 implants, it's just simply not true. But even considering that this is somebody's 1/2 of their finals, look, it's still just the size of teeth.
Yep,
it's just the shape of teeth. They kept their gums, they kept their bone, they have teeth that look natural. And if somebody looks in their mouth,
she's in a replica of what you have.
Yeah, it's
and
identical.
She's thrilled. She
Yeah.
sends us pictures all the time of being her in Disneyland. I'm like, oh.
So if you walk into a room and this is in your mouth, nobody's going to tell that they're fake teeth.
Yeah.
You can
Well,
tell.
no one's going to tell that there's only 2 bridges and
Or
not 3.
yeah, surely there's not just 2 bridges. But
Yeah.
Do we have, yes or no, Tiffany, do we have patients with 1 bridge?
We do, yeah.
Why do we have patients with 1 bridge?
We've had a couple patients come in and they've had like an implant failure right in front, and a lot of them are from out of town, and we're like, hey, we can replace this implant and start over your healing, or we can skip it and keep you in a 1 piece. And I think to date, every single patient has chosen the same thing, and that's to skip it and stay in a 1 piece on top or bottom.
Yeah.
And keep moving forward with treatment.
And some people's only option is 1 piece.
Is a 1 piece, yeah.
Because we don't have implants in all the right places because of the way that they presented to the office in the first place.
Well, not a single one of those patients have said, oh, this is different. Like, I can't. And it's like, they're all super, super happy with how it looks and feels. And I mean, they can eat and chew and smile and all the things that they've wanted to be able to do. So
good point. Yep. So David, I'm going to answer your question very specifically. But is that setup as strong as 3 bridges? I want you to envision a pencil. And if I asked you to take a brand new pencil and break it in half, it's pretty easy to break it in half. And if I give you half of that pencil and say, break it in half again, you're probably really strong, so you could probably do it. But if I give you the next little piece and say, break it in half, it's virtually impossible. It's really difficult to do. So ironically, when we talk about zirconia bridges, if we have segmented bridges, they actually get stronger the shorter that the bridge becomes. But I want to preface all of that by saying there is no way on God's green earth that you could break this bridge.
no.
It is incredibly strong. If these 2 were held together, I wish I had whatever. Even if this were 1 piece in zirconia, you wouldn't be able to break it. If you put a lot of effort into it, or maybe stood on it or did something crazy to it, you could probably break it because you're really strong. But
trauma type things.
Breaking zirconia is really challenging. It's really impossible. But that's good for the patient. I think the quest for segmented bridges is more about the bone stimulation. And there is good literature that says we want segmented teeth. That's why we're doing this in the first place, is we'd prefer to get some segmentation if we can, but it's just not practical or possible with every single patient. So is it as strong as 3 bridges? Yes. In your sense and your use of this prosthetic, yes, it's as strong. What would break one of these bridges? It's trauma. Aside from a trauma event, car wreck, slip and fall, smash your face on the concrete, it's virtually impossible. Yeah, a baseball bat. We're trying to think of all the things we're aware of, but it is virtually impossible.
Normal eating and things like that.
What do you do for tiny gaps when going into finals? Janet, what do you do for tiny gaps? I think
tiny gaps in the gums.
Yeah, reply what you mean. If you're talking about the gaps between your bridge and your gums, we're talking about gaps in between teeth.
Bridges.
Yeah. So Janet, if you wouldn't mind just clarifying your question, which gaps and where are the gaps? I promise I'll get it answered.
It looks better than 3 bridges.
Oh, yes, the gums. Okay. So when you come in for your second set of, or your second appointment, your 3 or your 4 month appointment, when we're going into your second set, Daisy's shaking your head at me. I must have skipped some questions.
No, not you.
Oh,
okay.
Okay. So we take new scans.
Yeah. Take all new scans.
We take all new scans because we're going to now tuck your teeth up into your gums on that second set of teeth. Right. So I would say almost every patient has gaps at their 3 month appointment.
At least some.
Yeah.
I think
somewhere in their mouth.
Yeah. And we always say, like, originally we were saying, oh, this patient must have used their water pick really well, or this patient must have, and now I'm like, the body's the body.
Yeah.
Because we have one patient who I know she uses her water pick. She takes it with her to work.
Yeah.
And she still has a little tiny gap on her upper right-hand side that will correct come her 3 month appointment.
Yeah, we'll just fix it. But gums heal. Mm-hmm. And during your surgery, most of the time we've pulled your gums really high on your teeth, and they're going to heal down and away from your bridge. Mm-hmm. So you're going to present at your 3 or 4 month appointment with some gaps, and that's what we're going to close at your next appointment. Mm-hmm. So when we give you your second set of teeth, our goal is, of course, to close off all of those gaps so your teeth look like they're growing out of your gums. Right. So I'm glad you asked that question. That's a good question.
And then between the teeth and
we got to go back up here. It looks like it's supported good enough with 3 implants. I have that since of method, but to me, the 2 bridges look longer. That's why I asked. Okay, no problem. Looks like better than 3 bridges to me. I was just wondering, got it. Yes, the gums, got it. Between the teeth and gums, got it. Is it possible to join the UFC with this procedure? Yes. Yes. Especially if you live here in Las Vegas, because that's where UFC is based out of.
Yes.
David Hunter, I did have one gap on the bottom after finals. I just made another appointment and Dr. Roberts fixed it. Yeah. So can gaps happen? Yes. And most of the time, can we fix it? Yes. Can we fix all of them? No.
Yeah.
I have a patient right now that transitioned from a denture, had very, very little bone. We knew this going into it, very thin tissue. Very thin tissue. And we knew going in, hey, we're probably going to have some gaps on the bottom, but it's a communication thing. Yeah. And down here, lower anterior, it's common to get some gaps down there. That's where it's pretty tough to close it off based on bone thickness, height, width, density, all that stuff. Mm-hmm. So obviously, we want to get the most cosmetic outcome that we can.
Yeah. When you do fix it, how do you fix it?
So we just got asked, if we do fix it after the fact, how do we do it? Most of the time, we get you numb in that little spot, make a little incision, pull some tissue from behind the bridge and put it in the front of the bridge. And usually don't even stitch it.
I actually have pictures on my phone.
Of one we just did, huh?
Yeah.
See if you can find it.
Because I sent it to a patient.
I don't want to gross anybody out.
I sent it to a patient. No, it's a clean picture. I sent it to a patient because she had the exact same question. So I'll find it.
Yeah. So oftentimes it's a little periodontal type procedure, and we can just fix it. I get my permanent teeth with Dr. Roberts next week. I can't wait for some of these giant gaps to be gone.
Congrats.
Congratulations, Emily. That's wonderful.
This is a tiny little gap.
Oh yeah, let's show that. That's a fair one to show.
Tiny little gap, but you can see that little tiny piece of metal showing. And it was funny because the patient, when we put it in her second set of temporary, she goes, "Oh, that's never going to bother me." And then we put it.
And it's really high up in her smile. So unless she goes around like there, you're never going to see it. But it ended up bothering her later.
Yeah.
And that's fine.
So this is immediately after the procedure.
Yeah, that's what, like at the same appointment.
Yeah, gone.
So
and it was super
we just
easy.
Pulled some tissue from behind it, put it in front of it, and it's going to heal very nicely, and it went away. So
hopefully I'll have a follow-up
Those are
appointment.
great examples. Thank you for showing.
Yeah, she's coming in not too long from now, and we'll get a healed picture, and then we can show you guys. But
okay, another thing we need to talk about is how are these bridges held in to your mouth?
not cement.
Not cement. Well, they
In
can
our-
be cement.
They,
In which circumstance would the bridges be cemented?
zirconia implants.
Yeah, if you had a zirconia implant. I don't place zirconia implants. There's a few doctors that might. I don't want to go down that rabbit hole today. That's not what's important.
Any advice for going into permanence designing teeth? I'm afraid of it being painful.
Emily, there's rarely any pain
pain
ever
associated.
associated with that appointment.
Yeah.
It's a fun appointment at my office.
Yeah, we tell patients you're kind of like a Lego piece at this point, or you can just
Yeah.
take the little thing.
Implants are in, they're stable,
They're happy.
and you're just
Yeah.
undoing little screws on top, lifting off the bridges,
Yeah.
putting new ones in. Okay, so I'm just gonna. This is not an actual implant; it's a model. I have another model down here.
If it was an actual implants for like a horse
implant.
Yeah, it's a big
So
implant.
the whole point of this is I just want to show you that if this was the implant that's down inside of the bone, see that some piece, this is called an abutment, attaches to that little implant, and then your bridge actually attaches to this abutment. Okay, there's another workflow that's pretty recent that that bypasses this little abutment.
Either way, there's a screw.
But either way,
that goes through the
yeah.
bridge.
But either way, there's
the
some
implant.
way that we screw this bridge onto this implant. Now I'm going to show you what that looks like. This.
Oh, thanks, David. We love you too. Sorry you have to go to work. That sucks.
I haven't been keeping up with this. And let's stay in chat, but duty calls. All right, go to work. Okay.
See that tiny little.
Wow.
I
Here, you
know.
try to hold it in your hand.
I'll try to hold it.
I'm going to
Sometimes if
show you the actual screw.
I have an idea. Because my glove will be enough of a different color.
We're going to show you the screw that holds the bridge onto the implant abutment.
And you'll see why it's very important not to talk during your appointment.
Yeah.
That is the
There's
screw.
The screw.
It is itty bitty teeny tiny. It's also like
So this,
super expensive.
yeah, these are like $30 a piece. This is the screwdriver that we use to drive the screw in and out. Okay, now put it on the end of there so they can kind of visually get it. So this is the screw that holds the bridge onto the implant or the abutment. Can these screws come loose during your temporary phase?
Yeah.
Happens all the time.
Happens all the time.
What happens if the screw comes loose?
You tighten
Tighten it back down.
Yeah, not the end of the world.
Can these screws come loose in your finals?
They can.
Yeah, it happens. What would cause a screw to come loose?
The number one culprit at our office is not wearing your night guard.
Yeah.
So you're grinding and clenching and you don't realize it. And it just slowly, that little screw is what's taking all the force. And you just slowly
wiggles loose.
wiggles.
Is it the end of the world if a screw comes loose? No.
No.
We drill out the little filling. I tighten the screw back down or replace the screw if we needed to.
Yeah.
We've had one break,
I've had one break.
so we just put a new screw in it.
The patient said, yeah, I have more on my night guard.
Yeah.
He does now.
And that patient wears their night guard.
He does now.
So I'm going to get that in a second. So we would just put just screw in, tighten it down, put a filling over the top of it, send it on your way.
You always take the bridge off and just make sure that everybody's still happy and healthy.
Yeah, I do
underneath the
check
bridge.
everything.
Yeah, you check everything.
Carl just said he wears his night guard.
Good boy.
Good job.
Yeah, keep wearing your night guard. Okay.
Please wear your night guard.
So how would I know it's loose? It'd feel weird.
It feels like your teeth are.
Yeah, most patients are like, something just didn't feel right. I feel like there was something I heard a clicky sound, or I felt like a movement, or I could tell like when I was chewing, like something just didn't feel right. I always tell patients, if something doesn't feel right, can I be the first to know and not the last? Because if something doesn't feel right, let's get you to get it checked.
Yeah.
Maybe it's nothing. Okay, I'll tell you.
Yeah.
Maybe you have a loose screw. Okay, we'll fix it. So, that's how you know something doesn't feel right. Are they 3-on-6? Who's they?
Yeah.
I'm 3-on-6.
I was like, who's they?
Maybe it's time for introductions.
Yeah.
Yeah.
This is Dr. Emmett.
Let's rerun. Yeah.
Okay, so
Introduce
yeah,
yourself.
I scooted this so close that we couldn't see my
Yeah.
name on my shirt. I'm Dr. Emmett. I am the 3-on-6 provider in Las Vegas, Nevada. And at my office, 3-on-6 is all we do.
Yep.
We don't do single implants. I don't do restorative work. I don't do anything else.
You needed something done this week, and
did-
what'd you have to
Listen,
do?
guys, I got a crown this week. And I went to my brother, who's a dentist here in Las Vegas.
Oh.
He's a phenomenal dentist. He did great.
We don't even have the stuff to do a crown.
But I don't have, yeah, he made a joke like, you could have done this. I'm like, no, I can't. I do not
don't have
have
the
the
stuff.
equipment or the stuff to do this in my own office.
Someone asked me in Colorado. They said, "What happens if you need a filling?" I said, "I go see Dr. Emmett's brother."
We'd have to go to another dentist.
And they're like, "But you have that stuff," and I'm like, "But we don't do it.
We don't do it.
We don't
We
do it."
are just a 3-on-6 office.
Mhm.
So are they 3-on-6? Yes.
Yeah.
We are 3-on-6.
High five. Sure are.
We are 3-on-6. We eat, breathe, live, sleep, everything 3-on-6. Yeah, I hope that was your question.
Oh, so true.
If it's not, he can ask.
I hope so.
Say,
Art. If Art, that
if
was
Art,
not your
that's not your
question,
question.
then let me know. Okay. I want to talk now. What time is it?
You're good.
Oh, we're doing good.
Yeah. We're great.
So I want to talk about color of teeth.
Yeah.
And let's start by talking about the color of your
Temporary.
first set of temporaries.
Yeah.
Where do we begin? Okay. So your teeth are printed on a 3D printer during the surgery while you are asleep. Okay, Emily, we'll get to that in a second. So I will not let that question go unanswered. While you're asleep. So do we have thousands of teeth colors? No, we don't.
Not for temporaries.
The company that makes these, it's a company called Sprint Ray.
Mhm.
The bottle is about this big,
It's
$795
it's an $800 bottle of resin.
for this little teeny bottle of resin.
And before you ask, yes, you can buy it cheaper. Guess what? It's really bad quality.
Yeah,
And the bridges break.
you can't buy it cheaper. You can't
We-
buy the
we
right
don't-
stuff.
We don't buy it.
Even though the
cheaper
doctors are
one.
like, you can buy it off brand. I'm like,
There was
maybe
one
you
doctor
can.
that was like, yeah, you can get the stuff out of Turkey. I'm like, you've seen their teeth, right?
Yeah, I'll just stick with paying for the right stuff.
Yeah.
Okay. So currently they make A1, B1,
A2,
A2,
Hollywood bleach,
Hollywood bleach,
regular bleach.
bleach,
I feel like they make them.
whatever. Let's say the
I think
company
they make 5.
totally makes 5 different shades.
Yeah.
In my office, we have all 5 shades, but we don't offer them to everybody. And I'll tell you why. A2 is too dark.
It's very dark.
So I do have
We didn't
one
even bring
patient.
A2 with us. Yeah.
I do have a patient who came in. He's like, "Get me out of these dentures, and I never want anybody to know that these are my teeth." And his teeth were pretty dark.
Yeah.
And I said, "Do you want teeth that look just like this?" "Oh yeah, give me the same ones."
Yeah.
He does talk kind of like that.
He does. He's an old cowboy. He talks just like that, actually.
So he has A2 temporaries, but I don't think I have anybody else in A2 temporaries ever.
No.
No. Okay.
Mm.
So
He's the only one.
the most common.
He's also the only one in C4 finals.
That's true. And we're going to show you what that looks like in a
Yeah,
second.
we'll show you what that looks
But
like.
C4
But yeah,
is really dark.
it's really dark. But he's like, I never had white teeth. Don't go putting white teeth in my mouth.
Yeah, don't give me white teeth now.
Yeah,
Okay,
okay.
so let's show him, Tiffany. Show him. So my number one shade is
B1.
my favorite shade is B1, and over 90% of my patients are in B1.
If I don't break
That was
if I don't
broken.
break the temporary,
broken.
it's okay. We'll reprint it.
So that's B1.
That's B1.
That's a lower that we printed to
Yeah.
bring over.
And I tell patients this is a really, really naturally pretty white without being very, very white.
Yeah.
This is what I want my natural teeth to bleach to.
Yeah.
Is a B1.
B1 is beautiful. And
Mhm.
for years, this is the only shade guide that dentists had for a very, very long time. And the prettiest shade in this entire thing is B1.
You can pick it
How
out
do
pretty. You can pick it out pretty easy on the screen.
Yeah, I'll just
Oh
set
yeah,
it.
on this.
I'll say on the screen you
So
can see which one B1
That's
is.
B1.
Yep.
And so to get B1 in plastic teeth is really amazing.
Yep.
And I say it's timeless even in your final shade. But in B1, you're not going to walk in the room and people be like, yo, your teeth.
Yeah.
They literally can be like, wow, he or she looks really good, and maybe not even associate it with your teeth.
Yeah.
But most our patients are in B1.
A lot
So
of
now hold up B1 and an A1 together. So A1 is a little bit darker. And I do have a few patients that go that,
Yeah, it's
oh,
hard
the
to see with the
lighting's so
lighting.
the
B1
lighting's
is
so
on,
good for faces, but bad for teeth. Oh, you can
B1
see
is
right
on
there.
top. A1 is on bottom. And say if I can get
Now
it.
I'm going to blow everybody's mind.
Yeah.
This
You
can
see
see
it?
it?
Okay. All right.
This is bleach.
That's Hollywood bleach.
That's Hollywood bleach. So do we have some patients that are in a Hollywood temporary? We do.
3.
Yeah. When patients like, I want white teeth. I want everybody on the planet to know that I have white teeth. I want to walk in with my white teeth and I want white teeth. Give me white teeth. Okay. You can have white teeth. That's what they are. They're very, very white.
Yeah.
They're very, very white teeth, but that's an option. We can totally give you a bleached set of teeth.
It's kind of funny because at our office, we have 3 bottles of B1. We have 1 bottle of Hollywood bleach.
I use
We're like, oh, we don't use
bottles
it
of
very often.
B1 every day. I made like 100 teeth
so many
this week.
teeth this week. Yeah,
And they're
teeth
all
this
B1.
week. Yeah.
So in fact, when somebody's teeth aren't B1, I literally have to stop and be like, wait a second, where's the right thing to make sure that I do not accidentally make this patient's teeth?
We notate it all over your chart, by the way. So you're not going to walk into the office and think that you're getting B1 and get Hollywood bleach. It's notated on your chart.
We'll make sure to give you the right
8
color.
different places.
Okay, we're going to do ketchup for a second. Catch up.
Ketchup. I love ketchup.
Oh, we have 10 minutes left.
You can either keep talking and answer all the questions at the end, or interrupt now and answer.
Let's interrupt and just do a couple
Let's
answers real
take
quick.
a couple.
Okay, so
Emily had a question about traveling.
curious. I often travel to Vegas for trips. Cool. I live in Alaska. Awesome. We have patients from Alaska, by the way.
Yeah, we do.
Could I come there just for my cleanings? Yes.
Yep.
How much do you charge? This is different for every office. I'm going to be very clear about this. We charge $149 every 6 months. I think it's a bargain. But guys, I don't make my money off cleaning teeth. So
we decided to charge that because that's what the hygienist
I just pay the hygienist.
We don't want to clean.
I don't want to clean your teeth.
Yeah.
You come in, you see the hygienist. If there's an issue, it's nice to come back to a 3-on-6 office.
Yeah. You'll always pop in and say hi and take a quick look, but the hygienist is
So
she's awesome, by the way. We love our hygienist.
I think that's a really good value. We hear prices all over that are more than that. So in Vegas, we charge $149. That's as of today. I don't have a plan to increase the price. Oh yeah, if you call Daisy, she hates $149. She'll say it's $150.
$150.
So it's $300 a year to have your teeth cleaned. And if something's going wrong, it's nice that you're at a 3-on-6 office because I can help figure it out. Yeah. So I always encourage patients to go to a 3-on-6 office for your maintenance if you can. But if you can't, you don't need to. Any general dentist office that has a modern office can totally maintain your 3-on-6 for you. And if they found something that they weren't sure about, they could always just tell you to go back to your 3-on-6 provider.
Just remind them that the teeth don't need to come out. That's kind of the biggest, just the teeth don't need to come out. So
if they want to come to doctor.
Or you can come see Dr. Emmett.
Yeah, I have patients right now who will fly across the country past tons of dentists and tons of 3-on-6 providers. Like, oh no, I only go to see you to get my teeth cleaned.
Yeah.
Like, okay.
And then Christy says, for our first consultation where I need to come into your office from out of town, we do lots and lots and lots of virtual consultations for out of town patients.
So for the first time, you don't need to.
Yeah, we always start with the virtual consultation because as cool as we are on camera, we just want to make sure that you still really like us before you fly in.
Before COVID, I would have told you that's impossible. Yeah. But now we got really good with doing virtual consultations. So all of my patients who fly in from Hawaii to Alaska, and across the country, they start with a virtual consultation. Let's talk about your case, talk about what's going on for you, and then we can help you. So anyway, I'm going to plug the office real quick. If you want to schedule a consultation, 702-710-9006. Ask for Daisy or Amelia. Or you can go to alloutdental.com. And keep in mind, I promise you, we will call you back, but we don't work on Fridays and we leave a bit early on Thursday. And I refuse to hire out of this country call center to take your call and act like they're helping you or give you bad information. So I always tell patients, leave a message because we're going to call you as soon as we get back in the office and give you all of the good information you're looking for. And obviously my own patients every patient of mine has my cell phone number.
Yeah.
So once you're a patient, you're not going to have to worry about calling the office. Okay.
Art says he's in all on X. He's not happy. He liked the teeth that the lady held. I'm going to say I'm the lady.
You're the lady.
Yeah, that's me.
Tiffany's the lady.
Yes. The teeth only, slurs a lot with the all on X. Can't eat a lot of foods. Lost 70 pounds. We hear that all day, every day. Yeah.
I bet you once a week, there's a patient in my chair that has an all on X. Sadly, some of those patients weren't even told there was an alternative. And if it was done many, many, many years ago, there wasn't an alternative.
Right.
Can that be converted into a 3-on-6 prosthetic? Most of the time, we can do something better. It's pretty challenging, but oftentimes there's just some things we can do differently, maybe taking out some of the implants, putting in some new implants, and get you into a prosthetic that is much thinner this way. Once the bone has been removed, the bone is gone.
Yeah.
So when we do conversions, it's pretty common to have some longer teeth and also maybe have a little bit of pink on the top of the teeth, but ultimately we'll get you much more narrow teeth in this dimension. So there's more room for your tongue. So we surprisingly can do a lot for patients that were in an All-in-X and want to convert over. Okay, we covered them all.
Well, you've converted a All-in-X to a more 3-on-6 like prosthesis.
Yeah.
And she had a complaint. She had too much room for her tongue.
Yeah.
And then she's been doing awesome with it. So
yeah,
it
totally.
was challenging.
It's possible. It's just it's tough.
But
and rarely can we use all the implants, if any, that were placed during your All-in-X. All-in-X is not a guided surgery. So we literally open up the gums, flat plane the bone, hack off all the bone, put in some implants wherever we see we can get them.
Have X-rays if you want to see.
And that's what you get. Whereas the 3-on-6 is guided. So we put all the implants at the exact perfect angle where we want them in the best bone. But that's the only way. One of the things that we don't talk about a lot is the perfect arch of where these implants are coming out on the teeth. It's the only way we can do a 3-on-6. Where you look at an All-on-X,
I guess
it's kind of there's a big variation. Look, we have an implant that's clear out here on the front side of this tooth. These are clear back here on the back side. This one coming out
clear
a hole on the other side of the tooth. And this is a really good one. And so oftentimes these implants just aren't even in the right arch
Art says that he has an X-ray. I reach out to the office, and we'll have Amelia or Daisy reach out to you. Oh, there you go. Daisy's
Somebody just put something.
Daisy's good. Yeah. Email them over, and then Dr. Emmett can take a look at them.
Always happy to look and see if there's something we can do to help you out. Okay.
Oh, yeah, for sure.
We only have a few minutes left. We talked about shade in the plastic teeth. So plastic teeth, there's not a lot of shades. I want to talk now about shade in your finals.
But remember, those are temporary.
They're temporary. It's only for a few months.
Just temporary.
We have 5 minutes left, guys. This is a introduction to the types of shades we have for your finals. We can do anything in your finals. I'll tell you that most patients in their finals are still in a B1.
A lot of patients are still in a B1.
And we have a lot of patients that go into a
1M.
bleach type shade, which would be a 1M1, OM1. Yeah. Let me show you what these look like. Oh, you have it right there. You can show
these are your bleach shades. It's kind of hard to see a difference. In my opinion, there's not a huge difference.
You can kind of see it right there.
Obviously, that's the brightest.
Yeah, you can see the top one's the brightest shade. Yeah. In your mouth, it's much more dramatic.
Yeah, for sure. I feel like I should hold them against my shirt.
Yeah, I tried to put some color behind it. Yeah, it's much more dramatic when you see it in your mouth. But remember that your final zirconia, we have a lot of autonomy. We can make a lot of changes to the shape, the shade, all of that stuff. So if there's any takeaway from today's live event, it should be your temporaries are they're temporary.
Yeah.
There's a lot of pre-planning that goes into making them as ideal as possible, but they're just temporary. We can always make some changes down the road.
Yeah.
There's ample opportunity for that. But our goal is to get you the most natural looking teeth that look like they grew there.
Yep.
And we will let you bring us pictures of yourself. We'll let you have plenty of input onto how this looks. It's not like, hey, you just got to, you get one set or everybody gets the same thing. That's just not the case.
Yeah.
It's very customized. What else do you think somebody should know about teeth and anything we didn't talk about yet today?
One thing is this is going to be one solid color.
Oh, good catch.
There's no translucency in it. It's the word that I can never remember. Monochromatic. There it is. As soon as I say that, I'm like, it'll come back to me. But it's all just one solid color. But once you get into your zirconia, there's characteristics that are built into it so that the very edge looks a little translucent, just like a natural tooth. Incisal edge.
Translucency.
Yeah, so that it looks more natural and things like that. So sometimes patients will go, well, I don't want it to look like that in my finals. It won't. It's
Yeah.
going to look much, much, much more natural.
Very true.
We've never put finals on a patient and have them go, oh. They always, I think our video just went up
Oh my
week
gosh.
ago.
We just put up the most fun
Mhm.
finals
Such
delivery.
a fun
We
finals
handed her the
delivery.
mirror and she lost her mind. It was so
She
much
actually
fun.
scared me because I was not anticipating.
She yelled.
She is a very quiet person. I was not anticipating that reaction.
Yeah. It's
So yeah,
was
check out our Instagram
super-
because that was
super exciting.
super, super cool. Yeah.
Okay. Oh, the last thing I want to talk about is your healing first bridge
Mhm.
is always one piece.
Yep.
So patients ask that all the time. Why
Solid piece.
do we just get, how many pieces is it from the beginning? It's always
One
just
piece.
one piece. Janet, you are so welcome. It's our privilege to do this. What's fun is these videos are live they're live when we do it, obviously, but then they go onto our Facebook and our YouTube and Instagram, and we have patients watch them after the fact and call us and reach out. And so we really are trying to do our best to help patients find the 3-on-6, because I promise you, if you are a candidate for a 3-on-6, there's nothing better. It is by far the best
Absolutely.
experience you can have with having fake teeth in your mouth. So again, we would love to see you in Las Vegas and have you as a patient. And if you'd like to come see us, you could call what number, Tiffany?
702-710-9006.
Or
I almost give you my cell phone number. Or go to alloutdental.com.
that's correct.
Yeah.
And we do virtual consultations from across the country. Over half our patients are not here in Las Vegas. But if you are in Las Vegas, you get it lucky. It's a short commute. You can pop over to the office real quick. And I think our local patients have a nice advantage.
Yes.
So anyway, guys, best of luck on your journey. We hope that we can see you in the office one day. And don't ever hesitate to reach out and ask us any questions. And we'll see you in 2 weeks. 2 weeks. Later. Bye.
Later. I like the later.
Later.
Lighter.
Let's see.
I don't remember how to end it. So we're
I
just
got
gonna
it.
sit
I
here
don't
and
know.
look cute.
End stream. End
Oh, you
stream.
copied something.
I copy pasted
Yeah,
something.
copy pasted something.
Let's get a professional
We
over
don't
here.
push the
Everybody was
buttons.
leaving. As we were finishing, people were like, gotta go. It's like perfect timing.